Clara Cassandra. Now I will explain about the nursing journal is rehabilitation exercise after surgical treatment of quadriceps tendon rupture program and chest report. And I hope you enjoy my video and thank you.
Okay, ready? I will explain the journal I took, and this explanation is divided into 5 parts: background, method, result, discussion, and conclusion. Background: patient with gout have an increased prevalence and severity of the case osteoarthritis. Osteoarthritis in Indonesia in rheumatic. Topic: occurring in calf joint can lead to limited knee joint rates of motion. Gait motion for the 6. Rustic in knee deformity and walking difficulty and often be regulated has been due to knee osteoarthritis. Patients with gout and limited knee motion were unexpectedly found to have intra-articular topping through magnetic results imaging or MRE and arthroscopy. Next, the treatment approach in such case has been arthroscopy removal of the intra-articular topping. Even with total knee arthroplasty in this patient might have higher possibility of poor wound healing and older complications need revision surgery. A study reported that painful knee locking caused by intra-articular topping was successfully treated with allopurinol therapy in a 6-7 years old man. However, future investigation is required to determine if UL lowering therapy or ULT is a favored alternative to allotropic removal. Method: research recruits and conducts face-to-face interview in a medical rheumatology center with patients with tuberculosis, gout, and limited knee motion. All the patients fulfilled the 1977 American Rheumatist Association criteria for gout. Research controlled a patient has having gout only if he or she had an acute episode. There was a zero that is caused differently in walking or using the affected joint. One hand episode that was most painful within 24 and was results within 10 days. Number 2, hand no pain between symptomatic episodes. Number 3, patient with topious gout. Number 4, limit knee motion. Number 5, egg 16 years old. Number 6, patient diagnosed with osteoarthritis and who have been advised to undergo surgical removal of topping or total knee arthroplasty by an orthopedist. The results all divided into 3 parts. Number 1, result critical characteristic of the 26 enrolled patient are summarized in Table 1. All the patients were male and had intra-articular topi of the knee on MRI. Table 1 note that the patient TSC topi and TA topi and knee motion were all improved after conical therapy. Number 2, at initial visit, illustrate the relationship between knee motion, TS topi and TSG topi at the patient initial visit. The danger of the motion is inversely related to TH2P in the knee figure 3A in journal. Number 3. After treatment, present the relationship between the increase in knee motion and reduce in TH2P and TSG2P after an average of 80.2 mon of congenital ULT. In figure for A, the increase in knee motion is shortly related to the reduction in TH2P. P equals 0.008, R equals 0.508. In figure for B, the reduce. This question, our student noted that all our 26 patients have reduced in TST2P and simulated improvement in knee motion after 80.2 mon of congenital ULT. Relate of initial severity. Additionally, TST2P can be used as a usable indicator and predicator in assessing the severity and predicting the potential improvement in knee motion. After congenital UST, TSG and TA2P were lower and knee motion was linger. The increase in knee motion was related older discretes in TS2P, which was also significantly related to the decrease in TSG2P. Additionally, the increase in knee motion was significantly associated with the decrease in TSG2P. This findings suggest that when subcutaneous 2P were successfully treated with ULT, knee motion was improved. Therefore, we can predict an improvement in knee motion when TSG2P decreases progressively. MRI is not selected as a routine clinical tool for assessment for topinous code due to its high cost. Therefore, TST2P evaluation can play a curricular role. The report MRI assessment of TH2P as an indicator of limitation of initial knee motion as well as an predictor of improvement in TST2P and knee motion. Conclusion: patients with COPE may have intra-articular 2P causing move limitation. 26 patients with focus, code, and knee motion respectively were analyzed and had totally intra-articular and subcutaneous 2P size measure as well as the amplitude on knee movement before and after urate lower therapy. After 12 to 24 months soft treatment, 3 was an increase in the range of motion in the knee, which correlates with reduction in total subcutaneous 2P size and with that in total intra-articular 2P size despite initial severity. Additionally, total subcutaneous 2P size can be used as an indicator of limit knee motion and their improvement as a predictor of knee motion improvement. Physicians should be aware that knee motion limitation might be related to intra-articular 2P even without any visible 2P on the knee surface, and that medical treatment can be yield favored clinical outcome.